Hey, Kavitha, thanks so much for joining us.
Hi, thanks for having me.
I really appreciate it. And I wanted to just compliment you on your incredible reporting. I'm trying to just see if we can remove the comments because they're sort of distracting. If you guys have questions for Kavitha about her reporting, about the story she's about to tell, just let us know. And I don't know why the comments, anyway, forget it. Don't worry about it. They always change how to get rid of comments on Instagram. But Kavitha, first of all, you have been covering the issue of reproductive rights in America really since Roe was overturned. Tell us a little bit about the work that's gone into this reporting at ProPublica.
Yeah, the latest work really highlights and raises questions about how health care for women has changed in states that banned abortion and can even lead to preventable deaths. And that was a question that we started out with in the beginning of our reporting because, this 50-year right to an abortion was overturned. There's so many doctors, even international organizations, warned of the harm that this can cause. And immediately we saw stories of women who said that they were denied this kind of health care during miscarriages that led to really serious consequences, but they survived. And so, we kept looking into who might be researching this, and eventually we realized that nobody is really researching or tracking this with the urgency that the situation demands. And so we started to do this ourselves. It's shoe leather reporting, requesting death records from these states, wrestling them free, talking to families, gathering their medical records, and then taking that to talk with experts, maternal health experts around the country to understand what we're seeing and connect the dots.
And you have recently done some really heartbreaking stories about two women in Texas in particular. Why has Texas been such fertile ground, pardon the expression, for these stories?
Well, Texas is there's a lot of reasons. One is that they have the oldest abortion ban. They put into place a 6-week ban even before Roe was overturned. That was a civil law, but it was very strict. And also, it's a state where if you're in the middle of Texas, to get to other states, even to drive to other states, is really a far distance to go. So people are more isolated there than maybe in some other states.
You told the story of an 18-year-old named Navia. Am I saying her name right? Nava, how do you,
Nevaeh.
Nevaeh, thank you. Nevaeh Crane. Just heartbreaking, who was pregnant and went to, I guess, wasn't feeling well, started vomiting. Tell us the story from there.
Yeah, she was about 24 weeks pregnant and was having her baby shower with her family, was excited about her pregnancy, and she started to feel ill. And when we spoke to her mother, my colleague and I reported this story together, her mother immediately, the story that she told was of going to um, 3 hospitals, getting turned away from 2 as she felt that her daughter was getting sicker in front of her eyes, and the doctors really only interested in the heartbeat. So we took that and asked more questions. We gathered those records. There was about 800 pages of them, and condensed them and started talking to experts about it. And they said that at the second hospital, she screened positive for sepsis and should never have been sent home. And by the time
The first hospital said what? That she had a fever. Didn't they just basically give her Tylenol and send her home?
at the first hospital, she was diagnosed with strep throat, and even though she had other symptoms, abdominal pain, nausea, that again, experts told us those are symptoms that you want to get checked out. You want a more thorough investigation of what's going on. Was told, well, it looks like you have strep. You can go
And
home.
at this point, she was 6 months pregnant, correct?
Right.
Okay, so the first hospital sends her home with strep throat. They don't even check that her abdomen, even though she's in severe pain. She goes home. She goes to a second hospital, and sepsis is starting to set in. In other words, she has this terrible infection, and that hospital sent her home too.
Well, that's what we know now. At the time, she screened positive, so that means there's a possibility of sepsis. And doctors told us that really warrants a much more thorough evaluation if that comes up. Again, she was sent home.
The-
She was back at the same hospital within 3 hours, I believe. Um, and this time things were really serious. And even then, it took 80 minutes for them to take her back to the ICU. The notes said that we looked at said that they were making time for a second ultrasound to confirm fetal demise, confirm that she was having a miscarriage, a stillbirth at that stage before they even brought her back. Which again, the doctor said there's no medical reason to do that, but that speaks to questions that we're raising about these laws that require um, doctors to record the absence of a fetal heartbeat before they
Yeah,
intervene.
I wanted you to explain that, Kavitha, for people, because there's very specific language in the Texas law that said if a fetal heartbeat is detected, then what does that mean in terms of the doctors who are helping a pregnant patient?
Yeah, and it speaks to so much of that confusion because there's actually two laws on the books. They have different language, different requirements, but the 6-week ban, it requires doctors to record the absence of a fetal heartbeat before intervening. There's also an exception for medical emergencies, but doctors said that that's a lot of times it's really encouraged to have all that documentation um, before doing anything that may be construed or perceived. Again, these are now questions that could come in front of prosecutors, juries, judges, people who don't have medical experience, to show that everything you're doing is by the book. Again, a lot of doctors tell us too, we're rule followers. Our whole experience and training is to follow the rules, and so that we proceed through the correct channels. And so when you bring in these laws that don't have really aren't rooted in science or medicine, um, they don't know how to handle them.
And in fact, you have interviewed countless doctors, OBGYNs, all kinds of people who work in kind of labor and delivery and caring for pregnant women. And many of them have said that they are terrified to intervene in these cases because there is this prevailing fear that they will be prosecuted. So as a result, a lot of these women are not getting the care that they need.
And I think one thing that often gets missed in this conversation is it sounds like there's one doctor there who's making the decision, and they're maybe too afraid of the law. But most of this care requires a team. It requires nurses, anesthesiologists, a lot of people to participate and all be on board. And in a lot of these states, this is kind of the only kind of medical care that has this provision. Healthcare workers are allowed to say, not participate, just not agree to participate in this kind of care. So sometimes the way that they're describing it too is also, can they get a whole team gathered to do the care? So in some hospitals too, do they have to go through other channels? And can they get approval from other people in their chain of command, or even like hospital administrators, legal team? Are they going to raise questions later? So it's really put a cone of questioning and criminalization around this.
Right. And then Nevaeh ultimately, when she was put into ICU at her third visit to the hospital, she sepsis took over her body and she died.
By the time they brought her back, it was too late. Her organs were failing. It's heartbreaking.
There's also an indication that she could have, that obviously she was having some the baby was in fetal distress. She was obviously not doing well. They could have ostensibly helped her give birth to that baby because they actually have the technology at that hospital to help an extremely, well, a relatively premature baby survive, correct?
That's the thing. We'll never know, but doctors said there are different scenarios that maybe if they had stabilized her much earlier, she would have been able to continue the pregnancy and continue on to term. Maybe she would have needed to be delivered earlier, but at 24 weeks, that's really the edge of viability. Maybe there was a chance that with that delivery, the baby would survive. Um,
Or
and
maybe she needed an abortion to
or
save her life.
exactly, maybe she, if intervening would have allowed her to survive.
And in Texas, there is an exception for the life of the mother, correct?
Yes, there's an exception. There's two laws, but the criminal one says to prevent risk of death or serious risk of irreversible, or each law, I've read so many of them, but substantial harm to a major bodily function or major organ. They're written in these really strict ways.
You also told another story about a 28-year-old Texas woman named Joseli Barnica. Is that right?
Joseli Barnica.
Joseli Barnica. So tell us what happened to her.
Barnica was a 28-year-old mother, and she was pregnant with her second child, again, excited to have another baby. And she went to the hospital at 17 weeks and 5 days pregnant, cramping and bleeding. And we know from looking at the records that very early on, when they looked at the ultrasound, they said, doctor said there was a miscarriage in progress. Basically, her cervix was open, the fetus had already descended, and it was an inevitable abortion. It was a matter of time um, until she miscarried. Her husband, who we spoke with, told us that when he rushed to her bedside, she told him that doctors had told her it would be a crime to intervene. You know, the standard of care in this kind of situation is to offer to speed up labor or to do a surgical procedure to empty the uterus. And again, if a woman in this situation walked into a hospital in Ohio or Massachusetts, so many states that don't have abortion bans, they could be delivered within 2 hours.
Wait, the
But
babe that wait, she was 17 weeks pregnant, is that right?
right,
So in other words, that baby would not have been viable. So she would have been able to get an abortion or to help whatever, get a DNC, whatever was required in any other state. So what happened? She was in a lot of pain. The doctor said it would be criminal to intervene. And then what
yeah,
happened?
3 days after the 6 week ban had gone into effect, and she waited 40 hours until they confirmed fetal demise, and then they delivered her. Um, and within 3 days, she was back at that same hospital. This time, she was septic, and she was there for about 6 hours before she died. Um, Again, we don't know. Um, the problem here is that the standard of care is to offer that delivery because infection can take hold um, at that stage. So the more time that you wait, the more opportunity there is for bacteria to enter and cause an infection like this.
I understand that maternal mortality has increased 56% since the abortion ban uh, has taken place in Georgia. Can you tell us what you're seeing about maternal mortality? Because that's a very high jump. And if you're seeing similar increases in other states with similar bans?
We haven't been able to look at that data globally at ProPublica ourselves. And I think this is really the question that nobody is urgently looking at this. The state has a maternal mortality review committee. That's a committee that is supposed to look at deaths of pregnant patients and review the circumstances, what happened. But they're not even up to the time period of when these bans went into effect. They're years behind and just catching up. Also, while they do publish data, they don't the individual findings of cases are not ever shared with the public. So that's part of the reason we're doing this research. But again, it's not we're not able to get a data set for the whole state in Texas. We have to go county by county and try to get these records. And even then, it's only a slice of those deaths because we're looking at autopsy records in Texas. So it's a complex question. I think it's going to be a lot of years before we finally have a full picture, which is why we felt it was so urgent to do this reporting and try to look for the actual cases and really examine them in depth and put faces to them and explain what happened.
Do you have any idea how many women have died since Roe v. Wade was overturned or since these strict abortion bans were put into practice in a number of states?
We don't. I think our reporting, though, just shows that there must be so many more because we're doing this, again, through looking at a small slice of the data that does exist. We're shoe leather reporting, calling up people, families to ask them to share some of their most heartbreaking stories with us so that we can take a closer look at them as journalists. And so just the fact that we have found these really signifies, I mean, we're gathering data from other states too. Some of them don't even release that kind of data. So the, there's so many roadblocks to finding these cases. But I think, and I think another thing maybe to share with people is that a lot of times families aren't even aware that these were related to bans because you know these are situations that nobody's prepared to face. So they don't know the questions to ask. It sometimes takes a reporter who's gathering these records and then sharing them with medical experts and coming back with a fuller picture of what could have been done differently to really even help understand what happened and what went
I
wrong.
I thought there was a federal law, Kavitha, that said that prevents emergency room doctors from withholding life-saving care. And the Biden administration has argued that that mandate applies to pregnant women who are in crisis. But many of these states are actually fighting that. Tell me about that.
Yeah, that's extremely relevant. No state has done more to fight that than Texas, where the Attorney General fought a lawsuit all the way up to the Supreme Court, which declined to hear it. That the state law, the state abortion ban, should not be superseded, should not be subject to this guidance from the Biden administration, basically saying that if the Biden administration interpretation that said that emergency rooms should be able to provide abortions if there's an emergency would make doctors commit crimes. He said it would turn hospitals into walk-in abortion clinics. So he won that case within the courts, and it's the only state that doesn't have to abide by that interpretation. And I think that is a big part of the chilling effect that doctors are pointing to when they're talking about why they would feel concerned about intervening in a case of somebody who might be experiencing an emergency.
This must be absolutely devastating for these medical professionals who are dedicated to helping people first do no harm, the Hippocratic oath, making sure that their patients are fine, and they must feel in some ways paralyzed from acting. Are many of these doctors leaving the state of Texas? What if they told you about the laws there and the chilling effect it's had on what they have been trained to do as medical professionals?
Yeah, this is not just Texas. A lot of states are experiencing. A lot of doctors that I've talked to, again, from 2 years ago, have left the state where they were in, whether it's Idaho or Tennessee, also Texas, and have said, this made me feel that I was put in a place between risking malpractice or a felony. I was really compromising my morals or my values, the things that I got into this profession to do. So that's a added layer to the maternal mortality crisis that so many of these states have been dealing with before Dobbs, before Roe was overturned. There was so much research about, and so many doctors have said this is just layered on top of that. Um,
And in fact, the United States has the highest maternal mortality rate of any developed nation before Roe was overturned. So, as you said, this is only added to the crisis. Meanwhile, you've also been reporting about Georgia, about at least two women who have died after they couldn't access legal abortions in a timely manner. Amber Nicole Thurman, who is 28 years old, a medical assistant in Georgia. She has had a 6-year-old son. Tell us quickly about her story.
Right. She was planning to go to nursing school and she got pregnant with twins. And because Georgia's ban had just gone into effect, they had a 6-week ban at the time that she found out she was pregnant. She could not get an abortion in the state. She was hoping that the situation would change because there was a court battle against it. So she waited a little bit longer, finally decided she had to go out of state. So she and her best friend traveled to North Carolina, nearby, and she had a appointment for a DNC procedure, but they hit traffic and couldn't make it in time. And this was right after Dobbs, so the clinic was inundated with people from around the country coming. So they offered her abortion medication, and abortion medication, is being used and widely used, especially after Dobbs, and is extremely safe and effective. Um, but complications can occur, and the advice is always to go to the hospital, get care if complications arise. And in fact, the clinic told us that she went to that if she had been in North Carolina, they would have done a D&C for free if she had a complication and came back to that clinic. Instead, she was back in Georgia. She went to her hospital, and from the records we were able to see, which was a summary of the case for the Maternal Mortality Review Committee. Doctors waited 20 hours before they provided the D&C to her. They talked about it twice over those 20 hours. She was bleeding from retained fetal tissue that was still in her uterus that needed to be emptied, and they during those 20 hours she got sicker and sicker, and her organs began failing. And again, by the time that they intervened, it was too late.
41-year-old Candy Miller was in fragile health. She lived in Georgia and found herself unintentionally pregnant. Tell us about her story.
Yes, I think her story really highlights two important issues. One is that so much of the conversation about these laws is there an exception to save the life of the mother? But those exceptions are written really narrowly to be focused on preventing death. There's no exceptions for health. And even when abortion is banned in some other countries, there's almost always exceptions for the health of the mother. So Candy had lupus, diabetes, and hypertension, all conditions that can be exacerbated by pregnancy. And her sister says that her doctor did tell her it would be dangerous for you to get pregnant again with those conditions, and it would be difficult to manage them with the medication that you're taking. When she got pregnant, though, there was no options in Georgia because abortion had been banned, and so she ordered abortion pills online. We don't know how far, her family doesn't know how far along her pregnancy was, just that she did experience complications, but did not go to a hospital. Her family said that the understanding in the family was that because abortion was banned, you could be prosecuted. This is not, no one has been prosecuted under these laws. And in fact, some states, Georgia is not one of them, but some states explicitly say that women can't be prosecuted. But again, this is the public messaging was that you could be prosecuted, and she didn't go to the hospital. Her family found her with a mix of fentanyl and the medication that's in Benadryl and Tylenol, and there's still questions about why, how she ended up with that mixture of drugs in her. But her family believes that she was not trying to end her life. Maybe she was trying to deal with the pain that she was in.
Why do you think these stories have not been reported on more and published more widely so people could understand what is happening with the urgency you believe these stories deserve?
Well, I'm hopeful that they are. We're seeing a lot of readers come to these stories in these days. I think I described earlier just the work that went into investigating and finding them. I think that's part of the reason is that these are really hidden. Usually any source of information only sees a window of it. If somebody worked at a hospital, for example, if we think of Barnica's case, maybe the doctors and the nurses who saw her on one day when she went home didn't know that she came back just a few days later and died of sepsis, and connected the dots between those things. Her family, her husband is from El Salvador and doesn't follow American news, doesn't know that there's questions about this care and how doctors are what kind of standard of care. They don't know the questions to ask because this was a wanted pregnancy. Nobody was expecting to have to ask this kind of question of what their options would be in that scenario. So I think that's part of the reason that these cases are hidden and hard to uncover, and which is why ProPublica is investing in looking into it.
I wanted to ask you about former President Trump because he's vowed not to enact a federal abortion ban, but he and vice presidential candidate J.D. Vance have both advocated something called a minimum national standard. What should people understand? I mean, this is really semantics, isn't it? Can you explain what they mean by a minimum national standard and what it would actually mean if it was put into practice?
Yeah. That's a great question. I wish they would explain more to us about what that standard would be. I mean, the most we've heard um, is, I think earlier, Senator Lindsey Graham was suggesting a 15-week minimum ban. And I think one thing that's very important to highlight about that is that wouldn't have covered a lot of these medical situations that we're talking about, somebody miscarrying at 17 weeks or having an emergency that needs to be dealt with at 24 weeks. Those kind of situations still wouldn't fall within what they're discussing, and especially if they were written with the same kind of penalties and vague language. But the other thing that I think people sometimes maybe aren't paying attention to is just that it's there's a very large and vocal anti-abortion movement behind these laws that wrote these laws that ended up getting passed, that have a strategy, and they are very much hoping to ban abortion and supporting President Trump for that goal, even if they don't think it's going to happen in the short term. It's the same thing. Nobody thought Roe would be overturned, but they're very strategic, and they have a long game and a large goal.
I wanted to ask you three questions my followers had asked me to ask, which is, what has been the response of anti-abortion advocates when they hear and read about these women?
We've been seeing a lot of messages and writing about how doctors are committing malpractice, and that's all that this is. I think
malpractice by not treating,
and that they should be treating. But from the very beginning, doctors were saying these laws are written in ways that would make doctors commit malpractice if they were to follow them, and they were not listened to. And major medical organizations tried to be involved in a lot of these states and in the process, and okay, is there a way to write an exception, even if these groups maybe don't agree with exceptions, that would allow for less confusion over this question? And they were over and over rejected. We've done reporting about this at ProPublica. There was one effort in Tennessee to change the language from prevent death to prevent emergencies, allow doctors to prevent emergencies, so that, again, this question of is a situation developing that could become an emergency? And instead of that passing, there was a really strong pushback. They said they wanted to keep the law exactly as it was, and they said that allowing doctors to prevent emergencies, they prefer doctors, I think the quote was, to pause and wait to see how this goes in situations where there might be a medical situation. So there's just again, like they just have not listened to the doctors
who are in the field facing
right.
these situations on a regular basis. Someone else asked if the families of the women who have died can sue the state or the hospitals involved.
I think that there are efforts to do that. I think in all the situations where they were at hospitals, the families are considering that option.
Well, Kavitha Surana, thank you so much, not only for your great reporting. This is so important for people to know what is going on in various states with very strict abortion laws. But please thank your bosses at ProPublica for committing the resources to do this kind of reporting, because I know it isn't easy. It's painstakingly slow, and I just commend you and all the other journalists who are doing this. So thank you, Kavitha.
Also from my colleagues, and people who are interested can go to ProPublica.org and read more. And if they know of cases that we should look into, also please reach out to us.
All right. Hopefully people will get that message, and we'll put something in stories where it's a link and people can read all your great work.
Thank you.
Okay. Thanks, Kavitha.